Hi, I'm Elaine, and I had COVID for 88 days. My experience with COVID was very scary. At the beginning, I honestly thought that I was going to die. The shortness of breath was just so severe. Um, it was very scary. Near the end of the 88 days, it was just annoying at that point because I couldn't do anything. I was on quarantine for 88 days per my doctor. My symptoms at the beginning were just a sore throat and fatigue. The next day, it progressed pretty quickly to shortness of breath, fever, and coughing. My whole body hurt. I had body aches, and it was just in general, it was an awful experience. The recovery process was very hard. It was a lot of waiting for me to get better. I had COVID at the beginning of March, and 88 days later I was released from quarantine. And even then I still had fatigue and shortness of breath with activity. So it was a very slow recovery. I had so many doctor appointments, so many virtual doctor appointments. I would be on my phone with my doctors and stuff. And even to this day, I'm still getting blood draws and seeing my doctor frequently, and specialists too. I see a lung doctor. I saw an infectious disease doctor. It was a lot. It was a lot to handle. At the beginning of March when I was diagnosed, a lot of people didn't even believe me because at that time it was an old person's disease, and I'm only in my 20s. And so it was very stereotypical for this disease to only affect older people. And that's not true. It affects younger people, and it affects them severely. So the public absolutely still needs to take COVID-19 seriously. It is it can be possibly very dangerous. Some people, yes, some people are asymptomatic and don't have symptoms. I do understand that. But other people can be very severe. Other people can die from COVID-19. And why take the risk? Wear your mask, wash your hands often, and social distance. Just stay at home as much as you can. Don't travel. Don't go to parties, and don't go to bars. It can be very simple. It will be a little bit annoying, but it can be very simple. So recently I accepted a position here at Kenosha County Health Department as a disease investigator nurse. I call people who are positive for COVID-19 along with the people in their household, and I trace where they've been within a certain amount of time, and I also tell them, I also educate about their isolation, and I do a lot of other education as well. But one of the main reasons I took this job is to empathize with these patients. I'm really able to empathize with them. I had COVID-19 too. My family had COVID-19 too. And yes, I do frequently disclose that with my clients. I say, hey, I had COVID-19 too. I get it. And that really, over the phone, I can even hear their comfort. And I think that makes a really big difference. I'm really loving this job. I think it makes a huge impact on the community, and I'm really, really happy to have this opportunity.